Neonates are the most frail patients in the hospital. A lot of studies have shown that the first 1,000 days of the life since conception of the babies are really important in order to set up the autonomic nervous system balance between the sympathetic and the parasympathetic. It's well known that newborns, especially those that born before time, they have an excess of sympathetic activity, and that has to be corrected through the NIPE processes. Maintaining a good temperature, good level of noise, good care is vital for those babies, because it's well known that high sympathetic activity will set up then a continuously high level of sympathetic activation during his life, and will end up normally with cardiometabolic problems and diabetes and even some psychological problems. This is the reason why we have developed the NIPE, the Newborn Infant Parasympathetic Evaluation Value. It's a number that goes from 0 to 100, expressing the percentage of the parasympathetic activity of the baby. We do it through heart rate variability, measuring the distance between R to R. So we offer you a directly measure of the parasympathetic activity of your patient. In that way, you will be able to know if your patient is comfortable or is under stress. We have certain publications showing that the NIPE value is very much related to flag score, for instance. We have publications showing how when you cocoon your baby, the NIPE values go high, expressing an increase of the parasympathetic activity, an increase of the comfort of the baby, without having any changes in terms of the people who is analyzing that data, because this is an objective measure. As well, skin-to-skin contact will increase those levels of the NIPE value, showing that the baby is getting more comfortable. The NIPE monitor offers you two numbers. The first one is the NIPE promediate, which is the one that you will use in order to assess the level of comfort of the baby during his stay in the ICU. But you have as well the NIPE instantaneous, which is a much less promediated value, a much more instantaneous value that will give you the idea of when nociception is occurring. If you are in a surgery, you will be able to detect with the NIPE instantaneous value when the doctor is making an incision and is making nociception, so you will be able to immediately administer more analgesics to the baby in order to maintain that balance between the sympathetic and the parasympathetic. Some studies have shown that the NIPE value is much more precise and specific than heart rate and blood pressure to detect nociception. In this way, you will be able to titrate your analgesics in a better way, so you will give much better care to your patients. Thank you very much.